You know, when you hear the word aneurysm, your mind probably jumps straight to a sudden, dramatic event in the brain or maybe the chest. But what if I told you there's another kind? One that can hide in plain sight, right in your legs. Okay, let's get into this, because the story of these aneurysms is definitely not what you think.
So, it really all starts with this one simple question. What is actually going on when a blood vessel in your leg, a vital highway for your circulation, starts to get a weak spot and bulge out? This is way more than a minor hiccup. It's the very first sign that something serious is developing.
All right, so let's get a clear definition here. What we're talking about is a lower extremity aneurysm. And simply put, it's a weak, balloon-like bulge in an artery wall. The official rule of thumb is when that artery has stretched out to more than 1.5 times its normal, healthy size. That stretching, that weakening, that's the heart of the problem.
The absolute best way to picture this is to think about an old garden hose, one that's been sitting out in the sun. Under all that constant water pressure, a weak section just starts to bubble out. Well, that little bulge, that is exactly what's happening inside an artery in your leg, usually in the femoral artery in your thigh or the popliteal artery right behind your knee.
Now, common sense would tell you the biggest fear here is that this thing is going to burst, right? Like an overinflated tire just popping. But here's the twist. For leg aneurysms, that's actually not the main danger. The real threat is something a lot quieter, and in many ways, a whole lot sneakier.
So, this is the part you really need to remember. A dramatic rupture can happen, but it's super rare. For those aneurysms behind the knee, we're talking less than 3% of cases. No, the far more common and dangerous problem is the formation of blood clots inside that bulging sac. These clots can lead to something called limb-threatening ischemia, which is just a serious way of saying your tissues are being starved of blood.
So how does this happen?
Well, it's kind of like a 4-step chain reaction. First, you've got the aneurysm, that little pouch, where blood flow gets all slow and swirly. It's the perfect environment for a clot, a thrombus, to form. Then, step 3. A piece of that clot can just break off. That's called embolization. And finally, that runaway piece travels down the leg until it gets jammed in the smaller arteries of your calf or your foot, creating a sudden, very dangerous roadblock.
Okay, so if these things are often totally silent until something bad happens, how on earth do doctors even find them? Well, the detection process is actually a pretty cool mix of old-school physical exams and some really advanced modern imaging.
Doctors have a whole diagnostic toolkit. It can start with something as simple as a hands-on physical exam, where a doctor can literally feel for a pulse behind the knee that seems unusually strong or wide. But the real workhorse here is the duplex ultrasound. It's totally non-invasive, super accurate, and it lets them see the aneurysm, measure it, and even spot clots inside. Then for planning a repair, they'll often use a CT or MR scan to get this incredible 3D roadmap of your arteries.
Right, so once an aneurysm is found and everyone agrees it needs to be treated, there are basically 2 main ways to fix it. And this isn't just a choice of tools, it's really a choice between 2 totally different philosophies of repair.
On one hand, you have the classic open repair, which you can think of as building a bypass around a traffic jam on the highway. And on the other hand, you've got the newer, less invasive endovascular repair, which is more like relining a rusty old pipe from the inside. One's the gold standard with a long track record, but a bigger incision and longer recovery. The other is newer, done through a tiny puncture, and gets you home from the hospital faster.
Let's look at that open bypass first. A surgeon makes an incision to get right to the artery. Then they take a new vessel, often a vein from the patient's own leg, which is pretty amazing, and they carefully sew it in to create a detour around the aneurysm. The old bulging section is then just tied off. So from then on, blood completely ignores the bad spot and flows through this brand new, stronger pathway. It's a real classic plumbing fix.
Now compare that to the endovascular approach. This is so different. A tiny catheter is guided through your arteries, usually starting from the groin, all the way to the aneurysm. A compressed, fabric-covered stent is on that catheter, and once it's in place, the surgeon deploys it. It springs open, creating a brand new, reinforced tunnel for the blood. The old aneurysm sac is essentially sealed off from the inside, all without a single large incision. It's pretty incredible technology.
So, we've covered the what, the why, and the how. But what does all of this actually mean for you? Let's get to the most important takeaways. Who is most at risk, and why finding just one aneurysm is often just the tip of the iceberg.
Okay, I want you to get ready for this number, because it is just staggering. For every 1 woman who develops one of these true aneurysms in their leg arteries, 30 men do.
a 30-to-1 ratio. That is one of the most dramatic gender gaps in all of vascular disease, and it's a huge, huge red flag.
And here's the other thing. It's almost never an isolated problem. If you look at popliteal aneurysms behind the knee, anywhere from 50 to 70% of people who have one in one leg also have one in the other leg. And get this, up to half of them will also have an abdominal aortic aneurysm, the kind people are more familiar with. This tells you something so crucial. An aneurysm is often a sign of a body-wide issue, not just one little weak spot.
So when you put it all together, the picture of who's most at risk becomes really clear. It's overwhelmingly men, especially over the age of 65. Smoking and high blood pressure are massive contributors. And like we just saw, if you've already been diagnosed with an aneurysm anywhere else in your body, especially your aorta, your chances of having one in your leg go way, way up.
And all of this brings us to our final, and maybe the most important point. It's not really a statement, it's a question for you. Now that you know that this is a silent, connected, and really high-stakes condition, what's the most important conversation you should be having with your doctor about your vascular health? Thinking about that answer could truly make all the difference.